first and last name?
Vanessa Murphy,
And your birthday?
4/17.
Whatever.
Mind your business.
What you can make up. Whatever. Can you please tell me where you are?
I am at Bates Technical College.
And what's the date?
Today is 4/20,
And the year?
2022.
There you go. Yeah, perfect. I'm going to give you 3 words to remember, and I'll ask you for them at the end, okay? So, building, flower, ball. All right. I need to listen to your lungs and see how strong you are and see how your muscles move. Can I do that now?
Sure.
Okay, good. So I'm gonna wash my hands and grab my gloves, and then we'll get started. And I will tell you what I'm doing, but also if something feels uncomfortable, or if I'm with your arm or leg wrong and or you need a break, just go ahead and let me know, and we'll pause for a bit. All right. I'm gonna start with the head, and so I'm looking at her hair, and again, hair texture. Does she have any areas? She has a lot of hair. If there is any alopecia, any areas without hair, thin hair, patches missing, thyroid disorder, high glucose levels, all of those things, malnutrition will contribute to different texture, and it's kind of a good way to identify that there might be something else going on that I need to pay attention to. Also, palpating the head, and if she was a 3-month-old baby, I would feel for the fontanelles. I'm also looking for the shape of the head, if she had any fractures that things may not have healed just the right way. Honestly, I can't even feel her skull. She has so much hair. I'm so jealous.
Get a haircut tomorrow.
That's not gonna thin it out. Sorry, right there. And so I'm just coming down and I'm palpating her neck, and I'm just looking for any swollen lymph nodes or anything like that. I'm paying attention to her skin as well. Next thing, I'm standing here, so it seems natural for me to just go ahead and check her ears. And I'm just gonna look. Her ears are intact. I am looking at the symmetry on her face, her eyes, her ears at the same time. So looking to see if there is any drainage. There is no blood or clear fluid that it would indicate cerebral fluid. I'm also looking behind her ear, because with masks and glasses and oxygens, there may be some skin breakdown. So I'm checking for that everywhere. All right, I don't see anything like that. I am now looking at her eyes. Can you take your glasses off for a second, please? And so I'm going to shine the light into her eye, and I'm looking for the pupil to dilate. Oh my goodness, this light died on it. Pupil dilation and constriction, and it is kind of dying in this, a little bit of constriction. I'm shining the light in the, I'm kind of blocking the light. So if I do this and shine the light on her left, then I can see the pupil constrict on the right side, or the other way. Now I'm going to ask you to follow the pen light with your eyes only. All right, so pupils are equal, round, reactive to light, and accommodation. Next thing I'm looking at her sclera and conjunctivi. So I can ask my patient, pull your eyes down a little bit, eyelids down, and I'm looking at the color, and so that is a good indication of anemia or liver disease. So that looks good. Can you take your mask down for just a moment or two? Thank you. It's so nice to see your whole faces, all of you guys. And she's smiling, so I can say that her facial nerve 7 is intact, and I can ask her to frown, or yeah, that's good too. So then the next comes the nose, and so I'm looking if she had oxygen. I would shine the light and also look and see if there is any irritation from the nasal cannula or anything like that. Okay, cover one nostril and take a deep breath, and do the same on the other side, please. Perfect. And now I'm looking at her mouth and everything that has to do with the mouth, right? And so when we talk about abdominal assessment and nutrition, that fits into that as well. So you're looking teeth, you're looking gums, you're looking loose teeth, you're looking broken teeth, dentures, sores, anything abnormal. You're asking your patient to stick their tongue out and move it from side to side. It helps with bulk creation, so you need to know the patient is able to handle that. We're gonna look inside and have the patient stick your tongue out and say ah, and then you're watching for the uvula move. I'm also going to ask you to swallow, please. Okay, and so that's important again in neuro, but also the abdominal and nutritional assessment, because we need to know if patient is able to swallow. Or she needs a feeding tube, which we can also do next week. Okay, so we are done with our facial assessment. We can do a couple of more things. I can put my hands on her temporomandibular joint and ask her to open her mouth wide. And I'm just feeling for any cracks or dislocation. The other thing you can do is have her move her jaw up and down, and that's again just helps you to know that the patient is able to eat. Yeah. If you wanted to check the sensory aspect of 5, then you can just touch her with a cotton ball and be like, "Can you tell me what you feel?" Okay, done with that. Moving on to our musculoskeletal portion of this. Bring your chin down to one side and then down to the other side. Lateral flexion, bring your chin down to your chest and back up and over your head and look from side to side. Okay, push against me and push against me. Don't let that push against me. Perfect. Shrug your shoulders for me. Perfect. I can palpate her shoulders, and I can just continue on, and I'll do this side because we can see better. So I'm just passively moving her joint, and it gives me an opportunity to really assess all the movements that I'm trying to get. If she had any creaking of the joint, any tenderness, I would feel it. Any warmth through the joint, I would be able to assess that as well. I'm doing the same on the other side. Also, I kind of want to do this before I have her do all the range of motion exercises, just because if there is any tenderness and pain with that kind of movement, I'm probably not going to have her go like this, right? Okay, are you able to bring your arms over your head? Perfect. And then to the side, and then back and front, and turn your palms up and down. Hold, don't let me push, don't let me push, don't let me push. Okay, flex your arms, don't let me push, don't let me pull. I'm being careful not to dig my fingers into her. Don't let me push, pull. Perfect, thank you. Okay, spread your fingers apart, don't let me push. Oh, good. And then squeeze my fingers. Okay, good. Now I am going to ask you to close your eyes for me. And give me your hands. Tell me when you feel me touch. And then if you can just rest your, yeah, perfect. Touch. So sensations and tact. Right, and I can also do sharp and distinguish between sharp and dull. Now that I have her hands here, I'm also checking for warmth. I'm looking for clubbing, and I'm looking for color. That's part of my respiratory assessment. 2 weeks from now, we'll check capillary refill as well. But those are things that I'm looking at so far. I will palpate her joints just to get myself caught up. Any pain, any tenderness? And we already assessed the strength, right? Do you guys remember that? Okay, perfect. Now I have my patient here, and so I don't want to go too far down. We did the head, the shoulders. We now know how to do respiratory assessment. So I'm going to go ahead and listen to her lungs now. Again, I am doing it over her shirt, because I do not want her to take her shirt off in front of all of you. When you are working with partners, when you are doing this at home with your family, friends, anybody else, please make sure you listen on skin, even if it's just yourself. So I'm going to start, she's smiling for the camera. She's practicing for her later appearance. All right, we'll get back to our respiratory assessment now. All right, so I'm going to listen, and so you can start here. So deep breath. In the beginning, you want your patient to do a deep breath because you're still learning what things sound like, but normal, slightly deeper than normal will do as well. Actually, I'm going to do it here so they can see. Every time I touch your stethoscope with the stethoscope. I thought I heard it wheeze.
You probably did.
And then I can do it one more time. And that's probably the last one here. So, depending on who your patient is, and you know, everybody is different. Like, I'm pretty short. You will probably put your stethoscope in like 4 spots and be like, okay, I'm done here. If you have somebody who is 6 feet tall, you may be able to do more than just 4 spots, right? But for me, that's probably what it is. Also, I think if you have a patient in the hospital, they usually don't have bras on, so it's the breast tissue is not like compressed, and so you could hear a little bit lower, but for our purposes here, we're gonna just know that more opportunities may be presented to you in a clinical setting. Okay, so now let's see. This is her left side, this is her right side. Do you mind just standing up for a second for them, because I want them to see. Maybe this way. So remember we talked anterior, posterior, and then the right middle lobe is kind of going to be hanging out right around here, right? So we're gonna listen to her lungs as well. And so give yourself a hug. And then take a breath. And out. And breathe normal. I'm just gonna show them the placement. So honestly, through all her layer of clothing, I cannot hear anything. So I'm just gonna show you where I would put the stethoscope. So I would go here, and here, and here, and here. And don't try to memorize where did I exactly put the stethoscope. You know, some things we do are like really precise. When we work on cardiac exam, the valve is going to be in one specific spot, and we're going to look for that specific spot. Lungs are bigger, right? So the specific spot is a little bit less important. The general area is more important. So this is going to be the general area, right? Gonna do the same on the back. We're gonna go spine here, and that serves my musculoskeletal assessment as well, because I can palpate her spine, and I can feel where her scapula is, and then I'm gonna go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remember we drew a letter J, like so. And so for women, it's kind of, your bra is sort of a cue, right? Because if you think about it, it kind of ends where the diaphragm is. So it makes it a little bit easier. I don't know how many of your patients will actually have bras, but think about it like stomach is here. Think about the xiphoid process, right? Stomach, and the diaphragm is right above that. So this is kind of the general level that you guys are thinking about. Does that make sense? I'm going to change glasses since I'm touching my sweater. Okay, does that sound reasonable so far? Okay, so go ahead and sit back down if you don't mind. So now we have done the shoulders and the lung assessment. We can continue on since she was just standing up. Actually, go ahead and lie down if you don't mind. So we'll just do on head to toe. We'll do head to toe, and you guys can, change things the way it makes more sense to you. So we'll do the same with hips as we did with shoulders. We're palpating the hip, just like we have to do your leg. And I'm just trying to, I'm gonna nap. All right. And so I'm just, again, feeling for that crepitus, tightness, any warmth, any tenderness, anything like that. And I need to go on the other side and do the same thing. I'll do it once. Now we need to check the range of motion. So bring your leg out and back in, and then the other leg out, left one and back in. Bring the right one up and then back down, and the same with the left. Thank you. Bend your knee and put your foot down, and I'm going to check internal rotation and external rotation, and then go ahead and do the same on the other side. Yep, and bring it in and out. Perfect. Okay, so we can say that she has full range of motion. Any pain, any tenderness, any discomfort when you do that?
That's my lower back.
Oh, that's not good. So we kind of need to figure out what's happening there. She's like, oh no, you're not.
I already had surgery, so.
Okay. All right, so now she's lying down, and it might be an easy time for me as a nurse to check her feet. Yes, so push against me, so up, yep, and push down. Perfect. And can you rotate your feet? Excellent. And this is the time when I can also check the sensation. So in front of you, I'm not doing that. In small groups, you take the sock off and you check the color of the feet, and you also check for sensations as well. And you can do soft and sharp. And is the patient able to distinguish it? If I touch her here and she says nothing, then I keep going up until she feels it. Okay? All right.
So then I had a question while you're doing this. What are we checking for again from the foot of the bed? Looking up towards the patient. I see.
It was from med surge.
Oh. So I can watch. So I walk into the patient's room, right? Let's say, and you're my patient. You're hanging out. So I can watch her respiration. I can count her respirations, and I can watch her chest rise and fall. And so that really helps me, because whenever you're not disturbing, but whenever you're talking to patients, their respiratory rate will change as well, right? And if I can catch my patient undisturbed, then I can count their respiration rate. I can watch their chest rise and fall. It gives me an idea of I can also tell you that her respiration is unlabored and effortless. Does that make sense? Her skin color is appropriate for her ethnicity, and she's not in respiratory distress. Would you agree, guys? Okay. So how do I know that she's not in respiratory distress? Yeah, perfect. Exactly. Yeah. Push against me. And push against me. Perfect. And push against me. Good. And don't let me pull. Don't let me push. Push against me. Good. And so
ridiculous.
Okay. I'm like, what's that sound? I didn't get it. All right. So go ahead and stand up. I'm going to show you a couple more things. We're going to walk over here, Vanessa. Okay.
My glasses on so I can see.
Oh, yeah, that's sometimes helpful, right? Okay, so chest expansion. You can do it anteriorly and posteriorly. Anteriorly, you just put your fingers kind of like so, to, I was gonna say toes touching, thumbs touching, and then you have your patient take a deep breath. And so your hands are coming apart and they're coming apart symmetrically, okay? Equal expansion. And you do the same thing posteriorly. Take a deep breath. And you guys can see my hands moving symmetrically. And when you guys are doing it with each other, you will feel them coming apart at the same time symmetrically, okay? So I am also looking at her and I'm assessing, you know, we talk about balance and symmetry and posture, all of these things, which I am getting just by looking at her. I am also assessing for barrel chest. And remember how we talked about when the alveoli get stiff and everything gets expanded, they push against the chest wall? Well, your ribs have cartilage on the end, so they're kind of expanding with that pressure. It doesn't happen over a day or two. It literally happens over several years. And so if she was barrel chested, then I would put my hands together. You know, we're not talking about the breast tissue, we're talking about just the chest wall, right? So this diameter here, the side, is usually, well, let's just say that this part here is twice as wide as the side. Does that make sense? So if I looked at the patient and they're equal here and there, then the chest wall has changed, right? It pushed out, so barrel chested. That is easy to see when you walk into a patient's room. You will see that they're sort of kind of rounded or barrel chested. That's where that comes from. Now that she's standing so nicely, we have palpated her spine earlier. So I am assessing for her balance, and I can ask you to close her eyes. And she's swaying just a little bit, which is fine. Don't leave your patient hanging out like so. Okay, and then we can also check for peripheral vision. If you can turn towards me, that would be great. Not an ideal way to check peripheral vision, but you can put your arms out, have your patient look straight at you, and then tell me when you can see my fingers come in.
The tips are your fingers?
Yep. Yep. Okay. And so we talk about 180 degrees, like normal standard for peripheral vision. And for a lot of patients who are older, that will start shrinking, right? And then also their depth perception will change as well, which again sets them up for fall risk. All right, now we can have your patient walk 5 steps forward, or 10, or whatever, and then come right back. Yes, are you practicing your Hollywood
Oh no,
walk?
I'm on Friday.
On graduation.
Yes, queen.
No, I got a wedding to be.
Oh.
Scared me out of the
All right. Okay. Anything else? Oh, well, so we can ask you to stand on one foot.
Got this.
And then the
I
other.
used to couldn't do this at all because of my back injury.
Oh,
So,
okay.
Go.
Good flamingo. Any questions?
At what point does the patient told to like push their
Scalio.
toes
Oh,
or
what?
like stand with their toes or something?
On your
Is there
tiptoes?
something like tiptoes?
Oh, sure.
Is it part of it or?
You know, you can make part of it. Basically, you're assessing a patient's balance, right? You can find whatever tool you like to assess that. That's where you as editors have a little bit of leeway. If she walked into a patient, if I saw her walk into the office or walk to the bathroom, that'd be it for me. It's just an assessment of the patient. So when you guys are listening to the chest, you're looking at the skin, if there are any scars or open areas or birthmarks that are worth noting. So all of those things are part of your everyday assessment. And when you're fully dressed, it's hard for me to say, I'm assessing her skin, but really that's part of your assessment all the time. So when you guys are working together in small groups, and if you have a tank top, if you're comfortable, you know, then that's a great thing to start kind of thinking about as well. Next week you will be doing abdominal assessments. So hopefully you guys can, you know, kind of be comfortable exposing your belly at least in small groups, just so we can learn how to listen. You guys will be here with Bill, okay? And if you guys don't do it next week, it's a really small assessment. We can build it into cardiac assessment the following week. I'm not stressing about that at all.
When are we testing for neuromuscular?
What we just did.
So we'll pass.
No, I just did that.
But when are we
Checking off.
checking off?
I don't know. We need to look at the schedule. There's that schedule.